Hello, this is Group 2. Group 2 consists of Jared Dowhower, Erica Cruz, Claire Connor, and Nicole Cornish. The leaders of the group this week were Jared and Erica, and we are here today to present to you the case of Mr. Ho. This is our patient, Mr. Ho. He is a 40-year-old man who moved here from Taiwan 3 years ago. He lives with his 21-year-old daughter and 23-year-old son-in-law. He speaks only Mandarin, and he doesn't have any relatives or additional support systems in this country. Mr. Ho does not follow a religion. He has a job working in a warehouse, lifting heavy items for at least 1 to 2 hours during the day. He denies regular exercise outside of his job-related duties. Mr. Ho has only used traditional Chinese medicine, or TCM, in Taiwan for the past 10 years. Mr. Ho started taking aspirin every day 1 year ago on his own after his brother had a heart attack at age 47. No other cardiac family history has been reported. Mr. Ho says that the only other medication he uses besides aspirin is Ma Huang, which he receives from a TCM practitioner. He takes this once a week to stay awake during the night shift at the warehouse. Mr. Ho smokes 10 cigarettes per day and has a 13-pack-year history of smoking. He denies the use of alcohol or illegal drugs. He also receives acupuncture once a month for chronic low back pain. At 5 foot 4 inches and 180 pounds, he has a BMI of 30.9, which is considered obese. He's been experiencing increased micturition and thirst, and denies additional symptoms. Mr. Ho has been newly diagnosed with type 2 diabetes. His A1C was 6.6%. His fasting lipid panel showed a total cholesterol of 180, HDL of 34, LDL of 88, and triglycerides of 180. He has not used cholesterol medications in the past. Mr. Ho did not have elevated blood pressure during his office visit. Diabetes type 2 is a disease of insulin deficiency and resistance. Insulin resistance is when abnormal cell receptor activity does not allow for the uptake of glucose into the cell. This leaves more blood sugar to be floating around in the bloodstream. This is worsened by obesity and decreased physical activity. This is because an excess of adipose tissue can actually contribute to insulin resistance. Genetics also plays a huge part in type 2 diabetes because patients will actually have a 15 to 45% chance of getting diabetes if both parents have it. Diabetes type 2 can cause a lot of life-threatening and debilitating complications, such as stroke, cardiovascular disease, peripheral vascular disease, neuropathy, retinopathy, and renal disease and failure. It's also important to provide the proper cultural considerations for Mr. Ho when planning his care. As a background, Asians in the US develop diabetes at a higher rate than the general population, even with lower comparable average body weight, and their average BMI is 24 kilograms per meter squared, which is not obese, it's actually borderline overweight. When communicating with Mr. Ho, it's important to get a Mandarin translator because he doesn't understand any English. It's also important to address Mr. Ho by his last name and to avoid direct eye contact because doing so would be misconstrued as a sign of disrespect. Mr. Ho belongs to the Chinese culture, and in their culture it is rare to directly communicate no. They would rarely ever say the word no. Rather, they would probably use silence. Silence could mean either misunderstanding or it could be a sign of respect. So it's very important for the practitioner to openly communicate with Mr. Ho and frequently ask if he understands things because he would rarely ever say no that he wouldn't understand something. It's also important to understand that Chinese families have very strong family values, they're family-centered, and that it's a hierarchical and patriarchal culture. So it would not be odd if he wanted to consult with relatives in Taiwan before deciding on the course of treatment. There is also a strong stigma of illness, so it's really important to emphasize to Mr. Ho that our conversations and all his plans of care and treatment would be kept private and would not be disclosed to anyone without his permission. Traditional Chinese medicine consists of a balance. It's known as yin and yang, and there's always a balance between two opposing forces. For example, internal and external, hot and cold, or emptiness and excess. Physical illness can be seen as an imbalance of yin and yang, fate or interference from ancestors, or other spirits to seek revenge or wrongdoing, or lack of self-control and behavior. It's important for the practitioner to understand their traditional beliefs so that we know what motivates their behavior. In terms of Western medicine, the Chinese view it as a hot or yang type of medicine, and any kind of hot or yang should be treated with yang, and it's most easily treated with food. Mr. Ho might ask which foods he should eat or avoid in order to get the balance correct between the yin and the yang. It's also important to acknowledge and accept traditional alternative treatments so as to open up the lines of communication between Mr. Ho and the practitioner and to foster a relationship of respect and partnership. Our goals for Mr. Ho include blood glucose control, self-monitoring, preserving renal function, controlling cardiac risk factors, and incorporating cultural beliefs and TCM into his plan of care. He has a target A1C of less than 7%. His preprandial blood glucose should be between 90 and 130. His peak postprandial blood glucose should be less than 180. LDL should be less than 100. Triglycerides less than 150, and HDL, greater than 50. We see Mr. Ho's lab results on the right-hand side. He is still maintaining his goal for A1C. For LDL, it's 88, and it is still within good limits. Triglycerides are slightly elevated at 180, and the HDL is also not quite high enough, it's only 34, and we want him to be over 50. We need to get Mr. Ho started on a medication treatment. We will be starting him with the first-line therapy for diabetes, which is metformin, and it is a drug that belongs to the biguanide drug class. We'll start him at 500 milligrams by mouth daily. This drug works by inhibiting gluconeogenesis and decreasing insulin resistance in the body's tissues. As an added bonus, it helps with weight loss, but unfortunately it can cause abdominal bloating, nausea, vomiting, and diarrhea, which can be alleviated if the medication is taken with food. We would also like to start Mr. Ho on an ACE inhibitor. Lisinopril would be a good choice for him. We would start him at 10 milligrams by mouth daily for renal protection, kidney sparing effects. The way lisinopril works is it prevents the conversion of angiotensin 1 to angiotensin 2, which is a potent vasoconstrictor. Some adverse drug effects are dry cough and hypotension. We would also start Mr. Ho on statin therapy. The American Diabetes Association recommends initiating statin therapy in diabetic patients because there is high-level evidence to support the use of statins in diabetics. It is shown to significantly reduce their cardiovascular risk factors. We would like to start him on Lipitor 10 milligrams by mouth daily. The adverse drug reactions to statin therapy could include abdominal cramping, constipation, diarrhea, flatus, heartburn, and rhabdomyolysis. We should also praise Mr. Ho for initiating aspirin therapy on his own because this drug is also known to produce cardiovascular protective effects in diabetic patients, so he will remain on the aspirin as well. We need to make some adjustments to Mr. Ho's treatment plan. In terms of the Ma Huang, another name for it is called ephedra, and the FDA has made it illegal to put ephedra in any kind of supplements or over-the-counter medications. This is because it has led to some serious effects. Some of the more common effects are actually anxiety, headache, nausea, psychosis, dry mouth, and irregular heartbeat. It has been shown to worsen diseases such as cardiovascular disease, kidney disease, and diabetes. So at this point, we would ask Mr. Ho to stop taking the Ma Huang and try to find an alternative to help him stay up late at night for his graveyard shifts at the warehouse. For diabetes and TCM concentrates more on restoring balance between the yin and yang rather than keeping track of blood glucose measurements. Some popular therapies for diabetes would be acupuncture and moxibustion. Moxibustion is the burning of bundles of mugwort. That is thought to restore the yin and yang. There have also been use of herbs to enhance carbohydrate utilization. The three most popular ones are the ginseng, the Siceraria, and the Psyllium. We would also be incorporating some lifestyle modifications into Mr. Ho's plan of care. It'll be important to teach him about smoking cessation, daily exercise, and dietary changes he needs to make. Now that he is diabetic, he shouldn't be eating as many carbohydrates, and he should be concentrating on taking in better carbohydrates for himself, such as whole grains and avoiding white rice. It's also important for him to follow a heart-healthy diet in order to keep his cholesterol under control. And we would also be sure to give him all of this information in a written format in Mandarin so that he can easily reference it whenever he feels the need. Mr. Ho should be scheduled for a physical exam 3 times a year to assess for his nutrition, physical activity, and reduction in cardiovascular risk factors and complications. We'll be monitoring his blood pressure, fasting lipids, A1C, and urine albumin to creatinine ratio. We also recommend annual eye exams because of the increased risk of visual loss and retinopathy. Each visit will also include a routine foot exam with skin being assessed for integrity, signs and symptoms of peripheral artery disease, and neuropathy, and we should also educate him on prophylactic foot care. Mr. Ho will also be referred to a podiatrist if needed for any types of foot complications. This concludes the case of Mr. Ho. Thank you so much for listening and have a great day.